Your heart is more than just a muscle. It's the engine of your body, working tirelessly, beat after beat, day after day, to keep you going. It pumps life through your veins, powers your energy, and responds to every moment of stress, joy, and rest. And yet, despite how vital it is, the heart is often taken for granted, especially as we age. It doesn't complain until something's wrong. And by the time symptoms appear, damage may already be underway. For seniors, protecting heart health is not just important, it's essential. Cardiovascular disease remains the leading cause of death worldwide, and the risk only increases after the age of 50. But here's what's often misunderstood. Heart problems don't appear overnight. They build slowly, often silently, through daily habits and small choices that either strengthen your heart or quietly strain it. The good news is many of the most common heart issues are preventable. Even if heart disease runs in your family, even if you've been living with high blood pressure or cholesterol for years, it's never too late to start making smarter, safer decisions. Your heart is resilient, and with the right attention, it can stay strong for many more years to come. In this video from Health Revival, we're going to explore 5 of the most common heart health mistakes that seniors make. Not out of carelessness, but often out of misunderstanding, routine, or lack of awareness. These mistakes don't always show up in dramatic ways. They're quiet, subtle, easy to overlook, but over time they can erode your heart strength and put your entire body at risk. We'll look at how things like avoiding checkups, sitting too much, underestimating stress, ignoring warning signs, and making certain food choices can impact your heart far more than you realize. And more importantly, we'll show you how to change course gently, realistically, and powerfully. Because your heart deserves attention. It deserves support. And you deserve to feel strong, steady, and fully alive with every beat. Mistake number 1. Ignoring blood pressure and cholesterol. High blood pressure and high cholesterol are often called silent killers for a reason. They don't cause obvious symptoms in the early stages but quietly and steadily damage the heart and blood vessels over time. For many seniors, one of the most dangerous mistakes isn't doing something wrong, it's doing nothing at all. Ignoring these 2 critical numbers, or assuming they're under control without checking, can be a slow path to heart attack, stroke, or worse. Let's start with blood pressure. Known medically as hypertension, high blood pressure means the force of your blood pushing against artery walls is consistently too high. Over time, this pressure causes microscopic tears in your arteries, making them stiff and narrow. That limits blood flow, stresses the heart, and increases the chance of clots, heart failure, kidney damage, and even vision problems. The scary part? You can feel perfectly fine while all of this is happening. There are no aches, no fevers, just a quiet, steady strain on one of your most vital organs. Cholesterol is a little different. Your body needs it to build cells and hormones. But when levels of LDL, the bad cholesterol, get too high, they start to build up in the arteries, forming plaque. This buildup narrows the arteries and can eventually block them completely or rupture, triggering a heart attack or stroke. Again, there are usually no symptoms until it's too late. Many people don't know they have a cholesterol problem until they end up in the emergency room, and by then, the damage has been done. The combination of uncontrolled blood pressure and high cholesterol is especially risky. It's like trying to pump water through a clogged, overpressurized hose. Something is going to give, and unfortunately, it's often the heart. This is why it's so important not to wait for a crisis. Prevention isn't dramatic, but it saves lives. Many seniors skip regular monitoring or doctor visits because they feel fine or because managing multiple medications feels overwhelming. Others don't want to hear bad news, or they assume aging naturally comes with these issues. But managing blood pressure and cholesterol isn't about age. It's about action. Small, consistent steps can bring both numbers into a healthy range, dramatically reducing your risk of heart disease, stroke, and even cognitive decline. Start by knowing your numbers. Get your blood pressure checked at least once a month at home, at a pharmacy, or during a checkup. Keep track of the readings and bring them to your doctor. A healthy blood pressure is generally around 120/80, though individual targets may vary depending on your medical history and medications. If your numbers are consistently above 130/80, that's a sign to start making changes or adjusting your care plan. As for cholesterol, a simple blood test can show your total cholesterol, LDL, HDL, the good cholesterol, and triglycerides. If your LDL is high or your HDL is too low, it's time to act. That might include lifestyle changes like cutting back on saturated fats, avoiding processed foods, eating more fiber, and moving your body daily. In some cases, your doctor may recommend medication to help manage your levels. And that's okay. Medication isn't a failure. It's a tool, a life-saving one. Also, don't forget about triglycerides, another fat in your blood that's often overlooked. High triglycerides, especially when paired with high LDL or low HDL, increase your heart disease risk even more. Eating too many refined carbs, sugars, and alcohol can drive triglyceride levels up. So, adjusting your diet can have a big impact. It's also important to recognize the connection between these numbers and your overall lifestyle. Stress, poor sleep, inactivity, smoking, alcohol, excess weight, all of these factors play a role. Fortunately, that means you have multiple opportunities to make positive changes. You don't have to fix everything at once. Just pick one habit and improve it. The momentum will follow. Even simple habits can lead to big results. A daily walk, a bowl of oatmeal in the morning, cutting back on fried foods, limiting alcohol, practicing relaxation techniques. These choices help lower both blood pressure and cholesterol over time. And the benefits go beyond the heart. You'll feel more energized, sleep better, and move with greater ease. If you haven't had your levels checked in a while, or if you've been putting off a follow-up, now's the time. Talk to your doctor about a plan, ask questions, bring in your blood pressure log, and don't be afraid to speak up if a medication isn't working well or is causing side effects. There are many options, and you deserve to feel good while protecting your heart. Mistake number 2, leading a sedentary lifestyle. A sedentary lifestyle is one of the most harmful yet most common habits affecting heart health, especially for seniors. And it's easy to understand why. After retirement, when daily routines become less demanding and mobility might be more limited, sitting often becomes the default. But while rest and relaxation are important, too much stillness can quietly sabotage your heart's strength and resilience. Your heart is a muscle, and like any muscle, it thrives on movement. When you sit for long periods without getting up to stretch or walk, your circulation slows, your metabolism weakens, and your heart loses some of the efficiency it once had. Over time, this can lead to increased blood pressure, higher cholesterol, weight gain, insulin resistance, and an overall decline in cardiovascular fitness. The connection between sitting and heart disease is well documented, and the longer the inactivity, the greater the risk. For many seniors, the challenge isn't laziness, it's uncertainty. Concerns about joint pain, fear of falling, or past injuries can make movement feel intimidating. There's also the misconception that you have to exercise in a structured or intense way to see benefits. But physical activity doesn't have to mean running marathons or lifting heavy weights. Even small, gentle forms of movement can strengthen the heart, improve circulation, and lower the risk of heart disease. Simple activities like walking, stretching, gardening, chair yoga, or Tai Chi can all get your blood flowing and stimulate your cardiovascular system. The key is consistency. Even just 10 to 15 minutes of movement 2 or 3 times a day can make a noticeable difference in your stamina, blood pressure, and mood. What matters most isn't intensity, it's regularity. One helpful approach is the move every hour mindset. If you've been sitting for 60 minutes, stand up and walk around the room, do some arm circles, or march in place for a minute or two. These short breaks don't require special equipment or gym memberships, but they remind your heart and your entire body that you're still active, engaged, and strong. Think of it as a mini reset for your body every hour. Strength training also plays a valuable role in senior heart health. Light weights, resistance bands, or bodyweight exercises like wall push-ups and chair stands help maintain muscle mass and support better balance and blood sugar control, all of which are linked to lower cardiovascular risk. Maintaining strength also makes it easier to stay mobile and independent as you age, which can reduce your risk of falls and hospitalizations. Of course, always check with your doctor before starting any new activity, especially if you have existing heart conditions or joint concerns. A physical therapist or fitness specialist trained to work with older adults can help you build a safe, personalized movement routine that fits your needs and abilities. This guidance is especially helpful if you're recovering from surgery, managing arthritis, or have limited mobility. It's also helpful to incorporate activity into things you already enjoy. If you love music, put on your favorite song and dance in the kitchen. If you enjoy nature, take a short walk around the garden or the block. If you prefer structure, look into community classes, senior centers, or online programs designed specifically for older adults. These options add structure and motivation and often bring a sense of joy and fun back to movement. The mental and emotional benefits of movement are just as important. Regular activity helps reduce stress, boost mood, improve sleep, and support clearer thinking. These benefits all play a role in heart health because your mind and your body are always working together. When you feel better mentally, your physical health follows. Movement becomes not just a task, but a tool for feeling good every day. Another powerful motivator is connection. Find a walking buddy, join a group, or ask a family member to move with you. Being active with others adds accountability, fun, and a sense of shared purpose. It also fights the isolation that many seniors face, another factor linked to poorer heart health. Social movement, even just a few minutes a day, can be a lifeline for both emotional and physical wellness. If pain or stiffness is a barrier, start slow and be patient. Movement often feels better over time, especially when paired with hydration, gentle stretching, and consistent rest. Don't be discouraged if progress is gradual. The goal isn't perfection. It's movement, and every bit counts. The good news is the body remembers. Even if you've been inactive for years, it's never too late to start again. The heart responds quickly to positive change. Within weeks of regular movement, blood pressure can begin to drop, cholesterol can improve, and your energy may rise. Mistake number 3, overlooking nutrition for heart health. Nutrition plays a central role in heart health. Yet, it's often misunderstood, overlooked, or oversimplified, especially for seniors. For many older adults, eating habits formed decades ago can be hard to change. And with so much conflicting advice out there, knowing what to eat for a healthy heart can feel confusing and frustrating. But the truth is, poor nutrition is one of the most preventable causes of heart disease, and ignoring it is a mistake that can quietly increase your risk over time. Many seniors focus on cutting out specific foods like red meat or fried snacks without paying attention to the bigger picture of their overall eating patterns. Others rely heavily on processed foods labeled low-fat or heart-healthy without realizing they may be loaded with sodium, sugar, or unhealthy oils. These small daily choices can add up, and over the years, they can put your heart under unnecessary strain. One of the biggest nutritional challenges for heart health is excess sodium. High salt intake contributes directly to elevated blood pressure, which in turn places stress on the arteries and heart. Seniors are especially vulnerable to this issue because many convenience foods from canned soups and frozen dinners to sauces, deli meats, and even breads contain far more sodium than the body needs. You might not even taste the salt, but your blood pressure feels it. Another common mistake is consuming too many refined carbohydrates and added sugars. These are found not just in sweets but in white bread, sugary cereals, pasta, and packaged snacks. These foods cause rapid spikes in blood sugar and triglycerides, both of which are harmful to your cardiovascular system. Over time, they contribute to inflammation, insulin resistance, and weight gain, all of which raise the risk of heart disease. The absence of fiber is another concern. Fiber found in fruits, vegetables, legumes, and whole grains helps regulate cholesterol, stabilize blood sugar, and support digestion. Many seniors don't get enough fiber in part because they don't eat enough fresh produce or rely on refined grains instead of whole ones. Without fiber, the heart loses a powerful protective ally. Fats also play a key role, but the type matters. Healthy fats like those found in avocados, nuts, seeds, and olive oil help reduce inflammation and support cholesterol balance. On the other hand, saturated fats from fatty meats, full-fat dairy, and many baked goods and trans fats found in some fried and packaged foods raise LDL cholesterol and increase heart disease risk. Swapping out these fats, not avoiding all fats, is the smarter heart-healthy strategy. So, what does a heart-healthy diet really look like? It's not about deprivation or strict rules. It's about focusing on whole, minimally processed foods that nourish your body and support your heart. Meals should include colorful vegetables, fruits, lean proteins, healthy fats, and whole grains. A piece of grilled salmon with quinoa and steamed broccoli is more powerful for your heart than any supplement or diet food ever will be. One helpful guide is the Mediterranean-style eating pattern. This approach emphasizes fresh produce, whole grains, beans, fish, olive oil, nuts, and herbs. It's been studied extensively and linked to lower rates of heart disease, stroke, and even cognitive decline. You don't need to live near the Mediterranean to benefit. Just adopting the principles can go a long way. It's also important to be mindful of how food is prepared. Baking, roasting, steaming, or grilling are all better than frying. And adding flavor through herbs, lemon, garlic, or spices instead of salt helps reduce sodium while keeping food enjoyable. Cooking at home more often, even just a few times a week, can dramatically reduce your intake of harmful additives and give you more control over your ingredients. Reading labels is another critical habit. Look at the sodium, sugar, and saturated fat content. Choose items with fewer ingredients and ones you can recognize. And be cautious with health halos. Just because something is labeled organic, gluten-free, or sugar-free doesn't mean it's good for your heart. If you have dietary restrictions, dental issues, or challenges with cooking, don't hesitate to ask for help. A registered dietitian can work with you to create a simple, sustainable meal plan that supports heart health while respecting your needs and preferences. Community centers and senior services often offer classes or meal support for older adults too. Eating well for your heart doesn't mean overhauling everything overnight. Start with one meal. Swap white bread for whole grain. Add a serving of vegetables to lunch. Use olive oil instead of butter. These small changes, done consistently, become powerful habits, and your heart will thank you. Mistake number 4. Avoiding medical follow-ups or screenings. When it comes to heart health, knowledge really is power. Yet, one of the most common and riskiest mistakes seniors make is avoiding regular medical follow-ups and essential screenings. It might be unintentional. Maybe appointments are delayed, blood work goes undone, or test results get overlooked. But when routine care is neglected, it opens the door for small issues to become big, preventable problems. It's easy to understand why follow-ups get missed. Medical visits can be stressful, time-consuming, or expensive. Some seniors don't want to hear bad news or feel discouraged by complicated results. Others may feel fine and assume that everything is okay until something isn't. But heart conditions often don't announce themselves with obvious symptoms. In fact, many of the most dangerous heart issues like high blood pressure, arrhythmias, or early artery blockages are silent until a crisis occurs. That's where regular checkups and screenings come in. These visits are not just for when you feel sick. They're a critical part of prevention. Your doctor can monitor vital signs, update labs, review medications, and spot early warning signs you might miss. Even one yearly visit can reveal patterns in blood pressure, cholesterol, blood sugar, and heart rhythm that offer a clearer picture of your overall cardiovascular risk. Screenings like EKGs, stress tests, and echocardiograms can detect abnormalities before they become emergencies. Blood work can uncover high triglycerides, elevated LDL cholesterol, or inflammation markers. All of these clues help your care team personalize your treatment plan and guide your lifestyle adjustments. Ignoring these tools is like driving a car with no dashboard. You won't know something's wrong until the engine overheats. Follow-ups are especially important if you've already been diagnosed with a heart condition, high blood pressure, diabetes, or high cholesterol. These conditions don't stand still. They change, and your treatment needs to change with them. Medication dosages might need adjusting. Side effects need reviewing, and lifestyle goals might need refining. Without regular contact with your provider, you're flying blind, and your heart can't afford that risk. Medication reviews are another key reason to attend follow-ups. Many seniors take multiple prescriptions, and without oversight, interactions or duplications can occur. Your doctor or pharmacist can help simplify your regimen, reduce risks, and make sure everything is working together for your heart, not against it. Even if you feel overwhelmed, try not to delay care. Write down questions in advance. Bring a list of medications and take notes during your visit. If hearing and memory are challenges, bring a family member or friend along. Many clinics also offer virtual visits or transportation assistance for seniors who need help getting to appointments. It's also important to speak up. Your provider isn't just there to give orders. They're your partner. If something doesn't feel right or if you're having trouble following a plan, let them know. Good communication can uncover barriers and lead to better, safer solutions. You don't have to manage your heart health alone. One overlooked screening that's especially valuable is the coronary artery calcium scan. It's a simple, non-invasive imaging test that measures the amount of calcium in your heart's arteries, a key indicator of plaque buildup and potential blockages. It's not part of routine checkups, but it can offer powerful insight into your true heart disease risk, especially if you have borderline cholesterol or a family history of heart problems. Vaccinations also tie into heart health. Flu and pneumonia vaccines can reduce inflammation and prevent complications that stress the heart. During flu season, heart attacks spike. So something as simple as an annual flu shot can be protective. COVID-19 and shingles vaccines may also play a role in reducing inflammation and keeping seniors healthier overall. It's never too late to reconnect with your care team. If it's been a year or more since your last full checkup, make the call. Ask for a full heart health panel. Request a medication review. Share your concerns, get your numbers, and make a plan. A good provider will help you prioritize your needs and take one step at a time. Your heart can't tell you it's struggling, but your test results can, and your doctor can help translate those results into action. Skipping appointments might save time now, but it can cost years of health later. Taking care of your heart isn't just about emergencies. It's about the quiet, steady work of prevention, the check-ins, the tests, the questions, the adjustments. Don't wait for symptoms. Don't wait for fear. Stay connected. Stay informed. And give your heart the attention it needs. Because the more you know, the more you can protect the life that beats within you. Mistake number 5. Underestimating the impact of stress. Stress is often dismissed as an emotional issue, something that lives in the mind. But when it comes to heart health, stress is anything but harmless. In fact, chronic stress is a powerful invisible force that can directly harm your heart. Especially for seniors, one of the biggest mistakes older adults make is underestimating how much stress affects their body, their blood pressure, and their long-term well-being. Stress doesn't always come from dramatic events. It can creep in quietly through loneliness, financial worries, caregiving duties, health concerns, or even the loss of routine in retirement. These feelings can settle in the background, becoming part of daily life. But just because you've grown used to stress doesn't mean your body has. Chronic stress activates the body's fight-or-flight response, releasing hormones like cortisol and adrenaline that raise blood pressure, increase heart rate, and constrict blood vessels. These effects, when sustained over time, put tremendous pressure on your heart. Over time, these physical changes wear down the heart and blood vessels, increasing the risk of hypertension, arrhythmias, inflammation, and plaque buildup. Stress can also lead to poor lifestyle habits, emotional eating, skipping exercise, poor sleep, smoking, or drinking more alcohol. These coping mechanisms might bring short-term relief but add even more pressure on the heart. For seniors who may be managing multiple health conditions or navigating big life transitions, stress can feel like a permanent background noise. And because it's not as visible as a rash or as urgent as chest pain, it's easy to overlook. But your heart feels it in the tension of your muscles, the pace of your heartbeat, and the strain it carries through the arteries. The good news is that managing stress doesn't require expensive treatments or dramatic lifestyle overhauls. It begins with awareness. Simply acknowledging that stress is real and that it matters to your heart is the first step. From there, you can begin to introduce practices that bring calm, clarity, and balance back into your day. Deep breathing exercises are one of the simplest and most effective tools. Taking slow, intentional breaths in through the nose, out through the mouth helps calm the nervous system and reduce heart rate. Just 5 minutes a day can lower stress hormones and support better blood pressure. And the best part is you can do this anywhere, at the kitchen table, in bed, or even while watching TV. Mindfulness and meditation can also help. These practices teach you to observe your thoughts and emotions without judgment, creating space between stress and reaction. Many seniors find comfort in guided meditations, prayer, or quiet time in nature, moments that reconnect them with peace and perspective. Even 10 minutes of stillness can create noticeable shifts in mood and blood pressure. Staying socially connected is another powerful antidote. Loneliness is a major source of stress for older adults, and isolation has been linked to a higher risk of heart disease. Talking with friends, joining community groups, or even regular phone calls with family can boost mood and lower stress levels. Relationships aren't just emotional, they're biological. They help regulate your nervous system and bring your heart into balance. Physical activity plays a dual role. It strengthens the heart and helps release pent-up tension. A short walk, some gentle stretching, or a dance session in the living room can trigger feel-good endorphins and improve both emotional and cardiovascular health. Even light activity done regularly can reduce cortisol levels and restore your sense of vitality and control. Sleep matters too. Poor sleep increases cortisol levels and blood pressure, creating a vicious cycle of fatigue and stress. Creating a calm bedtime routine, limiting screen time before bed, and aiming for consistent sleep can restore balance and resilience. Sleep is your body's reset button, and your heart needs that rest to stay strong. It's also important to reduce unnecessary stressors when possible. This might mean asking for help with household tasks, simplifying your schedule, or setting boundaries with people who drain your energy. Protecting your peace is not selfish, it's heart smart. Even minor changes in routine can free up energy for rest, reflection, and joy. Journaling or talking with a counselor can also be helpful, especially if stress is tied to grief, anxiety, or past trauma. Sometimes just putting feelings into words makes them more manageable. And sometimes guidance from a therapist can offer tools that help you cope more effectively and compassionately. Mental health is a crucial part of heart health. And asking for help is a sign of wisdom, not weakness. Your heart has been with you through every moment of your life, every celebration, every hardship, every quiet morning, and every deep breath. It works without pause, without complaint, quietly sustaining your life in the background. And now more than ever, it deserves your attention. We've covered 5 of the most common heart health mistakes seniors often make: ignoring blood pressure and cholesterol, living a sedentary lifestyle, overlooking nutrition, skipping medical follow-ups, and underestimating the impact of stress. These aren't flashy mistakes. They don't always call attention to themselves, but over time they can chip away at your heart strength, and they can steal years of vitality that you still have the chance to enjoy. The encouraging truth is this: it's never too late to change. The heart is remarkably resilient. Even small steps like walking a little more, eating a little better, asking one more question at your next doctor's visit, or taking a few minutes to breathe more deeply can begin to restore balance, lower risk, and bring your body back into rhythm. You don't have to do it all at once. Just start somewhere. One good habit can lead to another. One moment of care can create a ripple effect. At Health Revival, we believe that heart health isn't just about numbers and medications. It's about quality of life. It's about feeling steady and strong enough to keep doing what you love. It's about confidence, connection, and the freedom to move through your days with purpose and peace. And that's what we want for you. If this video gave you clarity, motivation, or hope, please give it a like, share it with someone you care about, and don't forget to subscribe to Health Revival. We're here to guide you every step of the way with compassion, wisdom, and the tools you need to take better care of your body, starting with your heart. Thank you for watching, and here's to a heart that beats stronger, longer, and with more joy than ever before.